Hello, my name is Dr. Kelly Austin. I'm a naturopathic doctor practicing in San Diego, California. My office is called Prime Wellness. AtMyPrime.com is our website, and what we mostly specialize in is hormone replacement therapy. So any sort of hormone imbalance, if you have a thyroid concern, your adrenals are off, or you're going through menopause, andropause, whatever your concern is to deal with hormones, we deal with it here at Prime Wellness. So when we look at hormone replacement therapy, we just focus on bioidentical hormones. Bioidentical hormones means that it's the same hormones that's in your body as is in the creams. So bioidentical just means same chemical. So your body does not know the difference between the estrogen and progesterone that's in your body and what's in the medications. So that's why they call it natural. So bioidentical hormones can be done in so many different ways, and that depends upon what the person wants to accomplish with the hormone therapy. I have some people who just want to regulate their cycle, so they want a regular cycle. I have other people who want to prevent a hot flash or a night sweat. I have some people who want to ensure that they have optimal health, and they're looking for anti-aging to help with things like building a strong bone and protecting against heart disease. And I have other women who they had a hysterectomy and they were put into menopause and they need something to get them out of it. Or people who just don't want to go through menopause. They want to have the hormones that they need to live a good, functioning, healthy life. And the hormone replacement therapy, there's both for men and for women. So when we look at the different kinds of hormone replacement therapy that's out there, we really want to look at taking the hormones topically. And that can be done through cream or through patches. Some people do injections, some people do the pellet therapy where they actually put the actual hormone cut into the skin, into the hip. But here at Prime Wellness, we really just recommend creams. Anytime you're taking a hormone orally, as in the case of a birth control pill, your risk of clotting and stroke goes up. It has to go through the liver. You have to digest it. It's not a good process. So creams do not have to go through the liver, and they don't have to be digested. So they go directly into your bloodstream. So there's several different options. Some people prefer a patch over a cream, but the patch tends to give you a little spike of estrogen, and then 3 days later it drops again because you're replacing the patch every 3 days. And then you still have to take progesterone because the patch is only estrogen. So when you look at a woman's hormones, estrogen and progesterone are always taken together. Those are the two main hormones. A woman's hormones have a certain rhythm to it. So if you're having any concerns with hormones, it could be anything from hot flashes, night sweats, vaginal dryness, mood swings, more depression or anxiety, more digestive issues. You could have concerns with things like brain fog or memory. It could be concerns with things like having more heart palpitations than normal. Libido goes down. So there's insomnia, not sleeping as well, incontinence, hard to hold your urine. All these things are linked to having low estrogen and progesterone. And they can happen as early as age 35, all the way up till middle age. So when we're looking at hormone replacement therapy, natural hormone replacement therapy, they can be done in two ways. So now that we know we want a cream, we want to know, should we do static dosing or should we do cyclical dosing? So static dosing means you're taking the exact same dose of hormone every single day. And this is how most doctors prescribe hormone replacement therapy. By taking the same dose every day, some people find it's very easy. It's cost effective. There's no real big mess about it. It could be done in a pump. It could be done in this little clicker. This is called a top and click. You just click out your dose and then it pops out the top. And then you can just rub that either on your outer tricep area, on your inner thigh. You would get a tub of estrogen and a tub of progesterone. So there's two different hormones for a woman. Some women need testosterone as well, but that's usually done at a later time. So this is static dosing, taking the same dose every single day, and this is the most common way to take hormones. Most doctors will prescribe estrogen, progesterone, and testosterone for a woman in one dispenser like this, which I believe is an error, which you're going to see in a second, because you don't take the same dose of hormones every single day. It's not how your body's meant to take hormones. So when you take when you have a separated estrogen, progesterone, and testosterone, you can dose change differently. You can see what the person requires, and you can just have them take that amount. So it is still an individual protocol, but you don't really seem to get so much benefits with static dosing. It might just help prevent a hot flash, or it might help you deal with some night sweats, maybe sleep a little bit better with some progesterone. But the main thing with static dosing is it just flatlines your hormones. That's a little bit of a worry because you're taking the same dose every single day, and your body, like I mentioned, wasn't meant to do that. So you can get an oversaturation of receptors. So all the hormones can go into the receptor site, and then we have a problem because at that point, there's no signal to shut off the cells from growing. So we always look at what are ways that we can do to optimize our hormones and the safety of it. So that's where we look at cyclical dosing. So if we want to put our level of hormones back to maybe where you were when you were in your 20s, 30s, maybe even 40s, completely up to you based on blood work and what you want to feel and what you're trying to get out of the hormone replacement therapy, we look at cyclical dosing. So with cyclical dosing, you can see what happens here is estrogen and progesterone. This is what it does in a whole month. So estrogen starts off really low, then you get this massive peak of estrogen, and then it drops way down here on day 12. Then you get another little peak, and then it drops down, and then that's when a woman would get her period. So estrogen goes up, down, up, down. That's why when we look at blood work, we always try to do blood work on day 12, the peak of her estrogen. That's the most estrogen her body will ever make is on a day 12. The drop of estrogen from day 12 to day 13, this little plummet right here, that is linked to the cells stopping being divided. And that's really important because that's where you get something called apoptosis, cell death. So they stop dividing, and it's safer for cancer. When we look at progesterone, it doesn't do anything the whole first half of the cycle. And then day 14 to 28, you get this huge buildup of progesterone. So progesterone should only be taken in the month, day 14 to 28, so that's 2 weeks. So that's why it cannot be put into a tub with the estrogen and testosterone, because progesterone needs to be only taken for 2 weeks of the cycle, whereas estrogen is taken every single day. So when we use this as a guideline of what we specifically want to follow, we can see that this is the rhythm that a woman should have her hormones in. Every woman, we know, from day 1 to 5 should have a certain amount of estrogen in her body. We know day 6, 7, 8, it will be a little bit more. Day 12 will be the highest. And same thing with progesterone. We generally have ideas and reference ranges to know where a woman's hormones should technically be in that cycle. But when we look at people in menopause or people in perimenopause or who had a hysterectomy or have a hormone imbalance, this is the optimal level that your body should be functioning in. But for them, they're not. Maybe the rhythm is way up here. Maybe the rhythm is too low down. The body still tries to keep the rhythm. Even if your ovaries have been removed or they're completely not working anymore, which we can tell based on blood work, then the adrenal glands kick in, and the adrenal glands still try to function to promote and make estrogen and progesterone. So when we look at hormone replacement therapy, cyclical dosing tends to be the most safest, most effective. If you're trying to build a strong bone, cyclical dosing is needed because this is the only rhythm your body knows. If you're looking at trying to prevent heart disease, cyclical dosing is the way to go. So this is anti-aging. You can put your hormone levels back to where they were when they were 40, 30, 20 years old, wherever you feel comfortable with and whatever your blood work enables you to do safely. And that is, we know, that is anti-aging at its best. When you're 20, 30 years old, we don't have osteoporosis. We don't have heart disease because we have the adequate level of estrogen and progesterone in our body to make a strong bone to protect our heart. So when we do blood work, the other peak day is day 21. That's the peak of your progesterone. So either of those days is great to run blood work, day 12 or day 21. The blood work is always done without applying the creams the morning of the test. The person just comes in, gets their blood done, and then afterwards they can apply the dose. Testosterone for women is very static, and then it just peaks in the middle there, right by ovulation, and then it drops back down again. So testosterone should also not be taken in large doses throughout the month for women. It can cause them to have extra hair growth, it can cause them to be more irritable, and it can cause them to have more hair loss. So those are the two main hormones. So this is cyclical dosing, which most women know from the Wiley Protocol and from Suzanne Summers being on this herself, and all of her books are written on cyclical dosing. So this is cyclical dosing estrogen, and then there's cyclical dosing progesterone. So this is for women. You'll see that they're color-coded. estrogen and progesterone, so they're dispensed differently. They're dispensed in syringes. So again, these are all creams. The amount of lines you take per day will be determined about blood work and where we want to specifically get your levels to. So I would tell you how many lines you would need to apply per day to match that rhythm that we were speaking about. Progesterone, same thing. If estrogen goes on one thigh, then progesterone goes on the other thigh. You never mix the creams. And we always say estrogen's done every day because you're a woman. You need estrogen every day. Progesterone is just in our bodies for 2 weeks, day 14 to 28. So you only take this one for day 14 to 28. If you get your period, that's now day 1. So day 1 is always the first day of your cycle. So you're taking estrogen, you're traveling along, everything's great. All the way up to day 28 is where we hope to get your period. Some people get it a little earlier, day 26. Some people get it a little later, day 32. But in that general region is a good way to have your cycle. And if your period does keep coming early, day 26, day 25, then at that point we would stop progesterone. You never take progesterone the first half of your cycle, right? We only take progesterone day 14 to 28. So if day 1 is the first day of your period, you would stop the progesterone. So if your period keeps coming earlier and earlier, usually it's indicative of you needing some more estrogen. And estrogen can drop for so many reasons. It can be dropped because of stressors. It can be dropped because the woman doesn't have enough calories in her body. She's exercising too much. She's not taking in enough nutrients. There's so many reasons to have low estrogen besides just going into menopause. That's why we can't really say the cessation of a period for a year means you're in menopause, because nowadays there's just so many reasons why women miss cycles. So that's one of the definitions, but we really do need blood work. So we do a full panel of blood work, and it's not just the regular estrogen, progesterone. We look at your free testosterone, all your receptors, FSH, sex hormone binding globulin. We look at your DHEA and those hormones in relation to your thyroid. And it's not just a thyroid panel where you're just generally doing a TSH and a T4. We look at about 8 thyroid tests. Free T3, T3 uptake, reverse T3, TPO, there's so many. So we want to make sure that we're not missing anything. And of course, focusing on your adrenal glands and nutrients are a big part too of what we do here at Prime Wellness. So once your hormones, we have kind of an idea of what we want to do with your hormones. And that would be either cyclical dosing or static dosing. The dose is done through the pharmacy. So the pharmacy sends us or the patient the bag. With all the hormones in it. The very first dose is always mailed to us. So we'll sit down with the patient and we will explain to you, how do you take the hormones? How do you apply it? Where do you apply it? What can and cannot take with the hormones? Are there any side effects you should be looking out for? How do I do the blood work? And how do you chart? Because when you first start the hormones, it's very generic. We say for the first month, just get the hormones in your system and see how you do. The hormones the first month take time to build. You don't have many receptors, and we can tell that because we look at a hormone called FSH. If FSH, follicular stimulating hormone, is above 25, we know that the person's lost receptors. So when you add in hormones, they don't have any receptors to stick to. Therefore, there's all this extra hormone floating in your system that can cause a problem. That's where women can get side effects, like the extra breast tenderness. They can get more bloating. They have problems maybe with some mood swings. The first month is difficult, and I always tell people just push past it. Once your body makes the appropriate amount of those receptors, you won't feel that way again. So after a month of charting, the patient will write down maybe day 9. Maybe the patient had insomnia. Maybe day 16 and 17, the patient had bloating. All of those things matter because after the first month, I can take a look at where the person charted and I can change the ratio of estrogen and progesterone for them or add in some nutrients or lifestyle changes to help them. So that month 2 and 3 are much better for them. When they're on hormone replacement therapy, it's important to follow up the first month that they're on this, because that first month we have to catch them, check and see what's going on, how is the creams absorbing, are they leaving any white residue on you, is it getting in okay? Because if it isn't, I have to change the base for them. We tend to use a really hypoallergenic coconut oil base, but there's many bases that may absorb in better in somebody else's skin. When we look at when we look at doing the labs, the first 3 months, that's when your body's baking as many receptors as it can to that dose. So at the 3-month mark, you'll definitely need to do blood work and it be a change in the dose, because at that point, the 3-month mark, that's all the receptors your body can make from that dose. You're not going to get anything more out of that. So we do blood work and a dose change. So that month 3 and 6, you feel a little bit better. There might be a couple things to work on, but that's why we do more blood work at month 6, another dose change, and then 6 months to 9 months, the person's feeling better. And then 9 months to a year, every 3 months doing the blood work and doing a dose change, they feel really smooth sailing. By a year, you feel good. You feel like everything is balanced, that there isn't anything really too off. And maybe at that point, we can start backing off on blood work if everything else looks great. And we might do blood work every 6 months after that. I follow up with my patients every 3 months. Some people see me monthly to ensure their nutrition and their exercise and everything and their supplements are on track. But every 3 months for hormone is a necessity because we need to change and stay on top of those dosings. There's nothing worse than hearing a patient saying, I feel great, I feel amazing. And then they miss their appointment, and then month 4 they call saying, I don't feel well, what happened? Because we have to stay on top of those receptors. That's why we try to stay on top of people and see them every 3 months before there's a problem. For men, there's also the same static and cyclical dosing, exact same thing. They would get a full container full of testosterone, and they can also get a container full of DHEA. So those are the 2 male hormones we look at. For men, we test free testosterone, sex hormone binding globulin, DHEA, and we want to know, where is this testosterone converting into when we give them these hormones? Is it converting to estradiol, or is it converting to DHT? That's why we measure all of those hormones, estrogen and DHT. We want it to convert to DHT. A man should not have a conversion of testosterone to estrogen. So these are also important to test. So same thing, we do the blood work every 3 months for a man. Cyclical dosing for a man comes in different colors, so it's color-coded, testosterone or DHEA. Exactly the same dispensers, static versus cyclical. A man's testosterone and DHEA changes just as much as a woman's does during the month. A lot of people don't realize that, but there is variation. So there's times in the month a man will say, great, I feel good, I want to get to the gym, I have good motivation. And there's times in the month a man doesn't want to get out of bed and really go and be motivated. And those are times where the testosterone and DHEA are a little lower. So testosterone and DHEA for a man are helpful for building muscle mass. They're helpful for mental acuity. They're helpful for libido and keeping erections. They're helpful for preventing night sweats. They help with endurance, just overall mood and overall confidence. When we look at testosterone and DHEA, they're actually done cyclically in the form of seasonal dosing. So what that means is once we do the blood work for the man and we figure out what exact doses we need, we will again tell him how many lines of DHEA or testosterone to take per day, and we work that out for him, and we also have him chart too. Because if there's something going on with the hormones, we want to catch it right away and we're going to fix it so that you get the optimal health that you're paying for with these hormones. And we want to make sure that they're working safely and effectively. When we look at testosterone and DHEA, the man has the least amount of testosterone and DHEA in his body in the winter. We know that in spring he has a little bit more. In the fall he has the most. So between, and then summer is intermediate. So fall dosing is always the highest. So we don't have to dose based on season, but that's how men tend to have their hormones being produced winter to fall. Blood work is really important, again, every 3 months, and then after a year, we kind of let him go and we see smooth sailing. If the patient isn't having as good results with the creams as we want, and we do all the dose changes, there's so many different little techniques we can do to ensure it's absorbing better, changing the base, having different peaks and valleys, and changing the actual method of besides the creams is also an option for men. There are testosterone injections, and those can be done in coordination with the cream to ensure you have a nice static dose. Because if you do an injection every week or every 2 weeks, you get that peak drop. So we want to definitely prevent that from occurring. So the creams are done through different compounding pharmacies. So they're all compounded to be clean. And they'll, like we mentioned, they also get delivered to us. We sit down, and the very first dose we go through with you, so you know exactly what you're doing and how to cope with this. The prescriptions are done every 3 months, and it is important to know that testosterone is a controlled substance, so we have to be very careful on how we monitor that. For the women who also need testosterone, it's dosed much lower than a man's dose, but we also do like the cyclical dosing where it's very low, and we would tell them basically what dose to take. Your hormones come in these little bags, which are really easy to use, and we basically can adjust the dose again as needed, and we would change that for the bag. We would write out all your calendars, so it becomes very, very simple. When we look at hormone therapy, what we hope people do is basically feel better right away within the first couple months. But again, that getting used to it is a little bit of a challenge for some people. Switching over from a pill or a synthetic, like a birth control pill, Premarin, Prempro, it takes a little bit of adjustment for the body. But I suggest anybody who's on an oral synthetic medication to switch over to bioidentical natural creams. It's just as effective, if not even more effective, and it's a safer method of hormone treatment. Now, for some women, they get a lot of breast tenderness when they first start hormones, or they've had breast cancer, and they're like, how can I go on hormones if I had breast cancer? Well, our main concern with that is not doing static dosing with them. Let's do the cyclical dosing, and let's be safe. They don't have to put their level of hormones back to when they were 20 years old, but what's very important is the ratio of estrogen and progesterone, making sure that they're balanced. So for my women patients who don't want to be on a birth control pill and they're only 15, 16 years old, then we can regulate their cycle, because they may not have a regular cycle, with bioidentical hormones. And then some people, just like I mentioned, take it because they had a hysterectomy, they're going into menopause, but the best time to really start the hormones is just before menopause happens, because then you can catch it before the bone loss happens, before the cardiovascular risk occurs. When we think about the side effects, the main one that I wanted to mention is the breast tenderness. Estrogen can cause a little bit of extra breast growth. So with that, we use iodine. So iodine is Lugol's solution. This is a 12.65 percentage. With iodine, we always start off with two things. We start off with a urine test, which is called a urine iodine test, and it's a test to see how much iodine your body has, because you can't take iodine if you don't need it, because it throws off your thyroid if you take too little of it. It throws off the thyroid if you take too much of it. That's why we call it the Goldilocks mineral. So iodine can, after you get the test and you say, okay, you need it, you can do an iodine spot test. So you can take your iodine, drop it onto your wrist, and then basically what you just do is you give it a nice rub, and it should the stain should stay there, hopefully 8 hours or longer. Now, when most people do the iodine the first time, it disappears literally in 2 hours. So what you want to try to do is reapply the iodine every day until it can stay longer. So iodine is great for breast tenderness because it blocks the estrogen receptors in the breast. So it's safe if you're wanting to talk about preventing breast cancer. Take some iodine, and once you know you need it, the stain is disappearing pretty quickly. You can apply the iodine to different areas of your breast, never using the same site the same day, the next day, because it can cause itching and irritation. So just moving it around the breast every day prevents breast tenderness. So iodine is a prescription, and we can call that in after we do an iodine urine test with you to ensure you need it. There's other hormones too that we do in cream form, melatonin, and this will ensure that people sleep well. And again, melatonin makes sure that it prevents breast cancer, but it ensures you have lower cortisol levels throughout the day, better cortisol levels in the morning. And the way that you can see this is cortisol is high in the morning, and then as it goes down as the day goes on. So when we look at cortisol being high in the morning and then dropping, that's kind of a nice rhythm that we always want to follow. And you can tell if you're doing that rhythm by doing a 4-point cortisol test. The 4-point cortisol test is done first thing in the morning, again at lunch, again around dinner, and then again at bedtime. So you should see that graph, the cortisol drop. Cortisol is a stress hormone. It's made from the adrenal glands. So if it's not following that circadian rhythm of high to low, you have a lot of problems. Cortisol high in the morning gives you energy, gets you out of bed, gets you moving. As the day goes on, cortisol drops, you can feel tired at night. So if your cortisol's too high at night, you're going to be feeling revved. If it's too low in the morning, you're going to feel exhausted. The concern is if your cortisol stays high at night and you have your revved, then you can't trigger the release of melatonin. And melatonin is the hormone that makes you fall asleep. And like I mentioned, protects against breast cancer, helps with growth hormone. So it's really important, first, get the adrenal glands set, get the cortisol rhythm working the way we want it to. And then some people need to add in melatonin. And again, melatonin is a hormone, so we don't take the same dose every single day. We vary it based on sunlight, the time of year it is, and that sort of thing. So melatonin helps you have a nice deep sleep. There's also vaginal creams people take that you actually insert into the vaginal wall to prevent against urinary tract infections, to change the pH of the vaginal area, and also to prevent incontinence. The vaginal wall gets weak as we get older, so the estrogen cream goes into the vaginal pelvic wall and pulls it up and really holds and makes a nice strong pelvic wall. So it helps prevent against incontinence as well. So there's many uses for these hormones, and the hormones are now viewed as being able to be taken every single day for longevity. We used to say take hormones for the least amount of time at the lowest dose, and now the theory has changed. We believe that we need hormone therapy to live a good, healthy, long, productive life. So without hormones, we could not live, we could not function. If someone had a thyroid problem, would we say, well, we can't take thyroid hormone, it doesn't work? No, we would give them thyroid medication because they know that they need that to function and to live. Same thing with estrogen and progesterone, or for men, testosterone and DHEA. These are absolutely needed hormones to help us function. So when we look at hormone therapy, if it's something you want to do, please join us at Prime Wellness and we'll get you set up with an initial consultation. And that initial consultation is 1 hour long, and we basically go through your health history, if you've been on any medications in the past, what supplements you're taking, your nutrition, because all that plays a big role in hormone therapy. We don't just give you a prescription and say goodbye. We look at everything involved in what you're doing that will affect hormones. So it's a very preventative, helpful, all-encompassing outlook on hormones. All hormones should be looked at because looking at one hormone in isolation is an error. They all work together as in a symphony. So after the initial visit and all the blood work is run, depending on what we choose to do or with you, or your cortisol test, the saliva cortisol test run, then based on that, we can put together a great protocol to get you started. And as we go through, it becomes more and more individual and tailored to your own health. It's not a one-size-fits-all. Hormone therapy does not come in one pill. It does not come in one injection. It comes in a variety of different doses and different dispenses depending on what the patient needs and what's right for your own body. And working with us, you can determine that through blood work, through symptoms, through talking and letting us know exactly what's going on. And we can fix all the hormone concerns that you have. So if you have any questions, please join us on our website. You can sign up for our newsletter at www.myprime.com. Again, I'm Dr. Kelly Austin, and thank you for joining us.